Hello people, in this video we want to look at scleritis. So basically here, whatever you're seeing here, the eye, the white part of it, right? This is the sclera, isn't it? What are you seeing? This is the sclera, this is the cornea, this is the sclera. Now in the sclera you have scleritis and this is anterior, that's why you're able to see it, right? So this is anterior scleritis, so inflammation of your sclera. This is scleritis with inflammation. In general, you have seen the differences between episcleritis and scleritis. So you know, just above the sclera you have what? The episclera, right? So above the sclera, look at this. So here you can see the layers, right? First what do you have? You have your tear film. After your tear film you have the conjunctiva. Below that you have the tenon capsule. Below that you have the episclera, and then you have the sclera. So in this video, what are we looking at? Inflammation of this, that is scleritis. Before this, whatever you have seen is the episcleritis. You have seen the episcleritis video, isn't it? So basically what you have to understand the differences between episcleritis and scleritis. Episcleritis, there will be no pain. Okay. There is no pain in episcleritis. In scleritis, there is pain. Okay. Mainly this much you have to remember. And as sclera is involved, in scleritis, you will have scleral edema. So here you can see scleritis is a very painful condition. There will be deep boring drilling type of pain, right? And this person cannot move his eyes also. And in this, what is affected? The sclera is affected. So there can be scleral edema. It is violet blue in color. If you see, you have seen this color, right? Violet blue in color. Because what is there below the sclera? You have your choroid, right? Inside your sclera, you have the choroid, right? So it can happen that you can see this violet blue in color, okay? And there are many types in this. You have the anterior type and the posterior type. Okay, in the types, what and all you have? Anterior and posterior. In the anterior, again, you have so many types, guys. Diffuse, nodular, necrotizing. This necrotizing can be with inflammation or without inflammation. Okay. So basically, guys, remember that this is because of autoimmune disorders like rheumatoid arthritis SLE. So this is very important. So this scleritis is a very painful condition and it is usually associated with autoimmune disorders. Okay. How will you treat it, guys? You need something anti-inflammatory, and you can give NSAIDs. Otherwise, you can give steroids. Otherwise, you can give immunomodulators like cyclophosphamide, etc. Okay. Remember, because this scleritis is a slightly more deeper problem than episcleritis. When you put 10% phenylephrine, right, that is a nasal decongestant actually. If you put that 10% phenylephrine, here in episcleritis, the blanching will be there, the redness will go away. However, in scleritis, the redness will not go away with 10% phenylephrine. What did I say? Yeah, 10% phenylephrine. So did you understand scleritis, guys? So what did you see? It's very painful. It affects the sclera. There are types in this: anterior, posterior. In anterior, you have diffuse, nodular, necrotizing. Again, necrotizing. You have with inflammation, without inflammation. This sclera can perforate, so it is called as scleromalacia perforans. Okay, guys. Then in posterior, because you cannot see, it is at the back, right? So there will be again pain. You know that pain will be there. Proptosis can be there. Then again here, because it's at the back, you have to give systemic steroids. Posterior scleritis, it can lead to posterior staphyloma. Okay. That is the protrusion of the uveal tissue, right? Then here, what is the color here? Violet blue in color. You'll have scleral edema will be there. It is associated with autoimmune disorders like rheumatoid arthritis SLE. And treatment we will give usually oral NSAIDs. You will try. Then you'll have to give systemic steroids or immunomodulators like cyclophosphamide, etc. 10% phenylephrine drops. They don't blanch because the vessels are deep, right? So what are the types of scleritis? You have the diffuse, nodular, etc. So in the anterior one. So this is the diffuse. So basically what and all you have in the anterior variety. Three things you have in anterior variety. You have the diffuse, nodular, necrotizing. In necrotizing you have with inflammation, without inflammation, and with inflammation, right? The one that you're seeing here now is the anterior nodular. Obviously anterior nodular will be non-necrotizing only. So this is anterior necrotizing without inflammation. Scleromalacia perforans. It will perforate. And this is the anterior necrotizing with inflammation. Okay. All four you saw. Good. So scleritis is the inflammation of the sclera proper. It is a serious disease. Okay. It can cause visual impairment, loss of eye also it can cause. Its incidence is less. Okay. It usually occurs in elderly patients involving females more than males. It is associated with rheumatoid arthritis, the most common association you should know. Other than that, you can mention Wegener's granulomatosis, polyarteritis nodosa, systemic lupus erythematosus, standard things that you will write. Then metabolic disorders like gout, thyrotoxicosis, some infections also can cause like herpes zoster. So infectious scleritis is also there. Granulomatous diseases like tuberculosis, syphilis, leprosy, sarcoidosis, same things you blame. Then miscellaneous conditions, they're saying irradiation, chemical burns, Vogt, Koyanagi-Harada syndrome. What is this one? So these people will have alopecia, poliosis, vitiligo, right? Poliosis is what? White eyelashes. So these people will have anterior and posterior uveitis, etc. Look at this. Vogt, Koyanagi-Harada syndrome. And as usual, you will say, okay, there's some surgically induced scleritis. As usual, you will say some idiopathic condition. So these people will end up destroying their own sclera. There will be some necrosis, destruction of collagen. And always you blame these cells, right? Lymphocytes, plasma cells, macrophages, polymorphonuclear cells, that is the neutrophils. They will be surrounded by some epithelial giant cells, like a granuloma now. Classification, we already told you there is anterior and posterior. In anterior, you have the diffuse, nodular, and then the necrotizing. Necrotizing, you have with inflammation and without inflammation. Without inflammation, they will end up going into a perforation, right? So what are the symptoms? These people will have pain, redness, photophobia, lacrimation, diminution of vision. Then, signs that you see. What will you see? In the nodular, you will see nodules around the limbus. Annular scleritis it is. Then you have the necrotizing with inflammation, necrotizing without inflammation, which becomes the scleromalacia perforans. Then you have the posterior, where you cannot see much, isn't it? Then coming to one more variety, they have the infectious variety. This accounts for a few of the cases. Here they have shown the infectious scleritis. You can see exudates, scleritis with purulent exudates. What will you see as complications in these people, guys? Cataract, secondary glaucoma, standard things that you will write, keratitis, keratolysis. What will you do as investigations in these people? Total leukocyte count, DLC, that is what? DLC, forgot the full form? Yes, the differential leukocyte count, then the ESR, serum level of what? Complements they are checking. They are checking basically for immunological survey. They are doing rheumatoid factor. They are looking for anti-nuclear antibodies, LE cells. All this is what? They're looking for SLE. Immunological survey. Then they're checking for syphilis. They're checking this person for gout. They're doing urine analysis, Mantoux test to check for tuberculosis. Wow. Then X-ray of chest again for tuberculosis or to rule out foreign body. Especially people with nodular sclerosis. What is this? Not sclerosis, scleritis. Okay guys, how will you treat this person? We already told you, you have to give here NSAIDs. Then you can give them steroids. Okay. Immunosuppressive agents like methotrexate, cyclophosphamide. Again, steroids. You can give surgery. You can put a scleral patch graft. So wherever sclera is like going to perforate or something, you can just put a scleral patch graft maybe to preserve the integrity of the globe in extensive scleral melt and thinning. Infectious scleritis, guys, basically here you will give antimicrobial therapy, so easy to say, surgical debridement you can do. And blue sclera in healed scleritis, you can see blue sclera, okay.